Good day to you all. My name is Ngonijasejipiyo and I am going to be presenting on the drug flu-deoxyglucose 18F. It is a mouthful of a name to call, so for the duration of the video I'll be calling it by its abbreviation FDG. So FDG is a radiopharmaceutical that is used mostly in the medical imaging modality of PET, which is positron emission tomography. Chemically, it is a glucose analog with the positron emitting radionuclide fluorine 18 substituted for a normal carbon atom that will be in the position. This is best illustrated diagrammatically, and this is the diagram of its structure. In this position here, usually there is a carbon atom in the glucose molecule, but now it has been substituted with fluorine 18, which is radioactive and decays over time. And when it decays over time, it releases radioactive energy which can be detected by specialized cameras, and these can be used to form a positron emission tomograph. Before we go further, I would take you through the uses of FDG PET scans in radiology. So these are used to form 2 or 3 dimensional images of the distribution of uptake of 18FDG within the body. It is a standard radio tracer used for PET scanning in neuroimaging and cancer patient management. PET imaging FDG can be used for imaging tumors in oncology. It is also used to assess glucose metabolism in the heart, lungs, brain, and other organs of interest. It is also used to monitor the treatment of cancer. The most complicated use is the PET CTFDG whole body scan. When they take a PET and a CT scan separately using FDG, and then they superimpose these images or fuse them to form one image for better resolution and for better diagnosis to be made. So this here is an example of where they take these modalities and fuse them together to form one image for use. The rest are just images showing what would normally appear when PET FDG scans are performed on bodies. Moving on to the mechanism of action of the drug. This drug, as I've mentioned before, is a glucose analog, and it is taken in high quantities by high glucose using cells such as those of the brain, brown adipocytes, kidneys, and cancer cells to facilitate their normal respiratory demands. FDG's transport is facilitated by a glucose transporter protein into the cell cytoplasm, and once it's in the cell cytoplasm, it is phosphorylated to 18F-FDG6-phosphate by the enzyme hexokinase. And when it is phosphorylated, it now remains in this state as the hydroxyl group which would have been in the atom is needed for further glycolysis to happen. Now that is absent, the FDG will remain in this phosphorylated state, and this gives technicians a window to image the FDG using the different concentrations for the different uptakes that would have made by the different organs to produce an image. The FDG will then decay with a half-life of around 110 minutes, which normally is referred to as less than 2 hours. And when it decays, the fluorine now will decay to a heavy isotope of oxygen, which is oxygen 18, and this is non-radioactive, and it can be metabolized normally in the same way as ordinary glucose and can to produce non-radioactive end products. This then eliminates the radioactivity from the body. 80% of FDG decays in this way, while the other 20% is excreted in urine as it would not be absorbed by other body cells. Moving on to the pharmacology of the drug. 18F-FDG decays radioactively with a half-life of around 110 minutes. This I've mentioned before, and its uptake may be changed by different conditions of the body. This includes fasting or by people who are diabetic patients, as their uptake of sugar is different, and this is a sugar. So diabetic patients, before the drug is administered to them, their blood glucose levels need to be stabilized on the day preceding the scan and on the day of the scan. The FDG should be used within 12 hours from the end of synthesis, and it should not be administered to a pregnant woman. This is mostly because data on how it affects children has not yet been accumulated and harmful effects are not yet known, so it is advised not to use it on pregnant women. Contraindications, overdose, drug interactions are still areas of investigation of the drugs. Side effects for those who have the drugs administered to them include hives, itching, rash, difficult breathing, swelling of lips, tongue, and throat. Here I've put a picture of someone with hives so that we can better visualize it, as it is a difficult side effect to note. And I'll move on to the routes of administration. So most commonly and most accepted, it is administered intravenously through a patent upper arm extremity arm vein, like most other contrast media, and it also involves an IV with normal saline running 5 to 10 minutes before the injection of FDG. And then you can also use a temporary small butterfly needle. This is an image illustrating butterfly needles. These are usually used for kids, and this is a chart showing the different gauges that can be used to administer the drugs, the syringes. And you can also administer it through an indwelling catheter or orally through oral administration. So this marks the end of my presentation. Thank you.